Maintaining kidney health is vital for overall well-being, and certain medications might pose risks to these crucial organs. It's essential to be aware of potential hazards to make informed decisions about your health care. Here, we'll discuss 10 medications known to potentially contribute to kidney failure in the US. Number 10. NSAIDs, or non-steroidal anti-inflammatory drugs. NSAIDs like ibuprofen, naproxen, and aspirin, widely used for pain relief and inflammation reduction, harbor kidney risks when used extensively or in high doses. These medications, as per a Journal of the American Society of Nephrology study, have been associated with increased kidney damage during long-term use. Typically prescribed in doses ranging from 200 to 800 milligrams every 4 to 6 hours, ibuprofen should be taken with food or milk, adhering strictly to recommended doses and avoiding prolonged usage. Number 9. ACE inhibitors, or angiotensin-converting enzyme inhibitors. ACE inhibitors, exemplified by medications like lisinopril and enalapril, serve as essential treatments for managing high blood pressure and heart conditions. Despite their efficacy in controlling blood pressure, these medications can pose potential kidney complications, particularly among individuals with pre-existing kidney issues. A clinical study featured in the Journal of the American Society of Nephrology highlighted an observed association between ACE inhibitors and instances of acute kidney injury. Typically, initial adult dosages may commence at 5 to 10 milligrams once daily, necessitating strict adherence to prescribed dosages, consistent monitoring of kidney function, and prompt reporting of any changes to a healthcare provider. Number 8. Proton pump inhibitors, or PPIs. Proton pump inhibitors, or PPIs, like omeprazole and esomeprazole, serve to decrease stomach acid and effectively manage conditions such as acid reflux and ulcers. However, prolonged or high-dose usage can pose a potential risk of acute interstitial nephritis, impacting kidney functionality. Studies outlined in JAMA Internal Medicine have directly associated the use of PPIs with an elevated risk of kidney damage. The standard adult dosage typically stands at 20 milligrams of omeprazole per day, with recommendations emphasizing the necessity of using these medications for the shortest duration possible while adhering strictly to prescribed dosages. Although generally taken once a day, individual needs may dictate dosage variations. Number 7. Antibiotics, aminoglycosides. Aminoglycosides such as gentamicin and tobramycin stand as potent antibiotics employed in severe bacterial infection treatments. These antibiotics possess a heightened risk factor for kidneys as they tend to accumulate in kidney tissues, potentially leading to kidney damage. An investigation featured in the Clinical Journal of the American Society of Nephrology shed light on the nephrotoxic tendencies of aminoglycosides. Dosage for these antibiotics varies based on the specific type and the severity of the infection. For instance, gentamicin might be prescribed at 3 to 5 milligrams per kilogram every 8 hours. Number 6. Antiviral medications, acyclovir. Acyclovir, an antiviral medication targeting infections like herpes, holds potential risk for kidney health if not carefully managed. High doses or prolonged use without adjusting for kidney function may lead to kidney damage. Research in the Journal of Clinical Pharmacology underscores the necessity of adapting dosages according to renal function to prevent toxicity. Typically, for oral herpes, a standard dosage might entail taking 200 milligrams every 4 hours while awake over a 10-day period. Number 5. Diuretics, furosemide. Furosemide, a diuretic utilized to address fluid retention, particularly in cases of edema linked to heart failure or kidney disorders, poses a risk to kidney health. This risk stems from the potential for excessive fluid loss, which can strain the kidneys, potentially leading to kidney damage. Notably, a study in the Journal of the American Society of Nephrology underscored the possible kidney-related complications associated with loop diuretics like furosemide. Typically prescribed at a starting dose of 20 to 80 milligrams once or twice a day, it's crucial to adhere to prescribed dosages, closely monitor fluid balance and kidney function, and promptly notify a healthcare provider for any concerns. Should you have any queries regarding your medication, we've crafted a dedicated book for your benefit. 10 questions everyone should ask their pharmacist. You can find the link in the description below. Feel free to explore it. Number 4. Chemotherapy drugs. Cisplatin. Cisplatin, a chemotherapy medication used in the treatment of various cancers like testicular, ovarian, bladder, and lung cancers, holds a significant risk for kidney damage if precautions aren't meticulously managed during treatment. Studies highlighted in the European Journal of Cancer and Clinical Cancer Research stressed the nephrotoxic nature of cisplatin, underlining the necessity for protective measures to preserve kidney function. Dosage varies depending on the specific cancer being treated. For example, intravenous administration of 20 mg once a day might be prescribed for testicular cancer. Adhering closely to the treatment plan, maintaining adequate hydration, and regular monitoring of kidney function are essential. Number 3. Antirejection medications. Cyclosporin. Cyclosporin serves to prevent rejection in organ transplant recipients by suppressing the immune system, a vital function to ensure the success of the transplant. However, this medication poses a risk of nephrotoxicity, potentially leading to kidney damage. Extensive studies published in Transplantation Proceedings and the American Journal of Kidney Diseases have delved into the nephrotoxic effects associated with cyclosporin usage. Dosage is tailored based on the specific transplant type and individual patient response. For example, kidney transplant recipients might initiate therapy with an oral dose of 6 mg per kilogram per day. Number 2. Antidepressants. Lithium. Lithium serves as a treatment for bipolar disorder and specific depression types. Its potential kidney risk stems from prolonged usage or high doses, which may impair kidney function. Research in the Journal of Affective Disorders correlates lithium use with chronic kidney disease. Dosage ranges widely, typically between 900 to 1,800 mg daily, administered in divided doses depending on individual responses. Careful adherence to prescribed dosages and regular monitoring of kidney function are essential. Number 1. Antifungal medications. Amphotericin B. Amphotericin B, an antifungal medication crucial in treating severe fungal infections, carries a risk of kidney damage, especially if not appropriately dosed or when other risk factors are present. Highlighted in a study featured in the Journal of the American Society of Nephrology, this medication's nephrotoxicity necessitates vigilant monitoring during use. Dosage varies based on the infection severity. For instance, treating fungal meningitis might involve intravenous administration of 0.5 to 1 mg per kilogram per day. Understanding the risk associated with these medications is crucial for safeguarding kidney health. Always consult healthcare professionals for personalized advice and monitoring when using these medications. Taking proactive steps and being informed can significantly contribute to maintaining kidney health while managing various health conditions. Remember, this information serves as an educational guide, and individual responses to medications may vary. Prioritize open communication with healthcare providers for personalized guidance and care. Welcome to Dr. Vivian Medications and Natural Supplements. Our channel is committed to delivering valuable health and wellness insights crafted by a certified expert. In these challenging times, staying well-informed about self-care is of utmost importance. If you find our content helpful, please support us by giving this video a thumbs up. Your feedback lets us know how we're doing. If you'd like to see more of such content, consider subscribing and activating the notification bell to stay updated on our future videos. Thank you for tuning in.